If you've just joined us, my name is Mark Correa, and I want to welcome everybody to today's webinar. So beyond mental health, the compliance essentials for managing psychosocial hazards. Before we dive into the presentation, I just want to cover a few housekeeping rules. If you do have a question during the webinar, please enter it in the Q&A feature, not the chat at the bottom of the screen. At the end of today's presentation, we will come back to aim as many to answer as many of these questions as possible. And there's no need to wait either until the end. You can type your questions throughout the webinar. We can see them. And we've already had a few people ask if the webinar is recorded. So yes, it is definitely recorded. And for those of you who would like to access the webinar, a link will be made available after the session has ended as well. Our webinar today, it's going to be presented by my colleague, Adrian Turner. He's the General Manager of HR and Safety and Group Counsel here at Citation Group. Adrian brings extensive experience as both senior executive and lawyer with deep expertise across employment law, workplace relations, work health safety, and corporate governance. His role as General Manager of Citation HR and Safety and Group General Counsel at Citation Group. Adrian oversees customer, product and service delivery functions whilst leading commercial, governance and risk initiatives across the wider group. He works closely with organisations to align people, processes and technology, ensuring practical, defensible frameworks to support sustainable business growth. We are thrilled to have Adrian present today and share his expertise with us as well. If you haven't attended one of our webinars in the past, here's a little information about Citation Group. Citation Group has been around for over 30 years now, working to help Aussie and Kiwi businesses by providing complete workplace compliance solutions that help create a better workplace. Whether you need help with HR, workplace safety, legal compliance, ISO certification, or specialist advisory services, Citation Group provide expert guidance, practical tools, and tailored solutions with decades of experience and commitment to excellence. Our team helps businesses like yours stay compliant, safe, and ahead of the curve. Today, we are featuring Citation HR. So Citation HR is complete, compliant and cost-effective solution that helps businesses keep on top of their HR obligations, streamline people management processes, save you endless hours and, of course, money. Whether you're a small business or large enterprise, every company needs a solid HR partner that supports and provides reassurance. One of those great things about Citation HR is we can provide tailored HR solutions for your business. Anything from HR advice line, where you can access workplace consultants, to our HR software and a library of resources, to the Advice Promise and Compliance Training Centre. We have a range of solutions to suit your needs. If you'd like to learn more about us, be more than happy to speak to anybody after today's webinar so we can work together on a bespoke solution for your organisation. And that's all for me, guys. I'll hand it over to Adrian now to start today's presentation. I hope you all enjoyed the webinar, and I'll see you guys a little later on.
Thanks very much, Mark. Yeah, so I think in terms of today's agenda, hoping to cover really the headline issues and get through as much as possible to help you get a better understanding of this emerging area. But most importantly, really want to focus on how you can practically manage the risk that's presenting itself more and more to employers arising out of psychosocial hazards in their various forms. And so we'll cover 5 key areas, being what psychosocial hazards actually are. We'll then kind of walk you through your obligations as an employer under work health safety law. We'll discuss the challenges about how they present themselves in practice, and we'll talk about building a culture of psychosocial and psychological safety, because like things in, or a lot of things in the modern workplace, building a culture and driving cultural change is, I think, the most impactful way to mitigate a lot of workplace risk. And finally, most importantly, as I mentioned before, we'll give you some practical steps and show you how to get the help that you need to best manage this area on the ground. And so just moving on to the first slide, I think it's important right up front to talk about, what exactly psychosocial hazards are, because there's a lot of, mystique around them and probably some misunderstood principles about how they manifest in the workplace. And so effectively what they are is they're aspects of work that have the potential to cause psychological harm. And so importantly, the law treats them just the same as physical hazards. So in the same way that there's a puddle on the floor, a psychosocial hazard is treated exactly the same as that physical type of hazard. And so they arise from three main areas. The first is how work is designed. The second is it's the environment that people work in. And the third is kind of the behaviours that occur in the workplace. And so work design hazards include high job demand, low control, lack of role clarity, poor change management, remote or isolated work. Environment hazards, poor physical conditions, inadequate resources, exposure to traumatic events, content. And, workplace behavior hazards cover bullying, harassment, aggression, violence, conflict, discrimination, poor management behavior. And so the key point is that psych hazards are not just people problems. They're risks that need to be, identified, assessed, and controlled under workplace health and safety law. There's a positive obligation under the law to do this now. It's rather than, sweeping ideas of what mental health in the workplace is or isn't. Very specifically, that's confined in workplace health and safety law now, and it's something that all employers need to get across. And so just on to the next slide, I think, following on from that, I think what we can make of the whole area around psychosocial hazards, it's that, it can be a bit opaque. It's very difficult in some instances to actually see these things as an employer. And so there is obviously warning signs, things like increased absenteeism, workers disengaging from meetings, high rate of workers' compensation claims, people avoiding certain managers or teams, reports of stress, burnout, and fatigue, those types of things, but the key point is you don't need someone to lodge a complaint or, for a workers' compensation claim for there to have been psychosocial hazards present. The law expects you, as I'll touch on in a second, to look at these things proactively. And so just on that, on to the next slide. If you look at what the law actually requires of you as business owners, I think, importantly, got to take things all the way back to the basics. Under the Model Work Health Safety Act, employers or businesses or anyone who falls under the definition of a person conducting a business undertaking, which is a term I'll touch on in a second, they've got statutory legal obligations under work health safety laws. And so the most fundamental concept in work health safety law is that employers have a duty of care to ensure the safety and well-being of people in their workplace. So that's the primary legal responsibility that overarches everything in the work health safety space. And really all your responsibilities and obligations as employers in respect of health and safety at work, psychological or physical, it all drops out of that duty of care. That's your fundamental thing that you need to be across. It's the way that you discharge that in different forms, but you can always draw a line to the duty of care. That's what your primary obligation is. And so the other thing I'll just point out is, unlike employment law, work health safety is governed at a state level. So in each state, there's a work health safety regulator, WorkSafe, Safe Work, whatever the moniker is in that state. And the legislation is largely the same. There's some subtle differences between each state, but, principally your obligations are enforced by a state regulator and they all sort of come back to the primary legal duty of care. What I mentioned before around a PCBU, that's a term you'll hear when you're talking about work health safety. If you've ever had an inspection from WorkSafe or Safe Work, they would refer to you as a PCBU in the forms and documentation that they'll give you. And in its purest form, the PCBU is just anyone who operates a business. So in 9 out of 10 times, it's an organisation. So it's the employer. So the PCBU is the employer. They're the ones who hold all the obligations. But it can also be an individual if that individual is conducting a business in their own right. So sole traders, self-employed persons, they are a PCBU for the purpose of the work health safety legislation. So the PCBU, they're the ones that have the legal duty to ensure the health and safety of workers. They've got that primary duty of care, and they need to discharge that primary duty of care so far as reasonably practicable. And that's the standard by which all obligations drop out of. So you need to do things as reasonably practicable. So you don't need to do things that are way outside the realm of comprehension, but you also can't do something that falls below the minimum expectation. So if there's a giant hole in your floor, it is reasonably practical to think that you don't allow people to walk anywhere near that. So that's kind of everything needs to be looked at in context and what is reasonably practical. And so the general duties of what does the duty of care actually look like? It's what you're seeing on the screen there. So, ensuring proper consultation. People are talking about health and safety and have the opportunity to talk about it with their employers. It's ensuring the work environment, systems of work, machinery, equipment, safe and properly maintained. Adequate workplace facilities, ensuring information, training, instruction, supervision is being provided, workplace conditions are being monitored, incidents are being reported. All of those things are what the duty of care actually looks like in practice. So we can talk about the duty of care, that's your obligations, but how do you do it? That's those things that you're seeing on the screen there. And so if you go on to the next slide, in essence, what the health and safety legislation mandates that you must do is firstly to identify the hazards. So you need to go through a process to find out what could cause harm. What are those things in your workplace that could cause harm? Assess the risks of those things. So understand the nature of that harm that could be caused by the hazard, how serious the harm could be, and the likelihood of it happening. And then you need to put in place what we call controls. So implement the most effective controls that is reasonably practical in the circumstances to ensure that it remains effective over time. And then review and control those measures, and make sure they're working as planned. And so having a risk assessment system to carry out those things that you're doing on the screen at the moment, what you're seeing on the screen at the moment, is essentially what your primary obligation is to do. Assess, what other things that could cause my people harm? How could they cause people harm? What's the degree of it? Put controls in place that are proportionate to that thing. So if someone can fall off the roof, of a skyscraper, is very difficult to the risk of them, overusing their wrist from, writing too much, and you need to put controls in place proportionate to that. So, the other thing that you need to do, you need to be able to prove and evidence that you've done those things as an employer. And so I like to compare that, the obligation you have under health and safety law to kind of maths problems at school. So not only do you have to be able to provide the right answer, you need to be able to show how you got there. And that's what Safe Work will ask for when an incident occurs. So it's well and good to say, well, we've got systems in place to protect our people. We have documentation around how our people are supposed to respond to these issues, protocols, procedures, etc. But you need to be able to show that, and you need to be able to demonstrate how you enforce those things in practice rather than, a suite of documentation that sits on the shelf and gathers dust. You need to be able to show it. Otherwise, how can they believe that this incident that you're saying, well, it's not reasonably practicable for us to be liable around this thing because we had a system in place to try and prevent it, which is absolutely all you need to do. If some accidents happen, you're not liable if you had those things in place and they were reasonably practical. If you can't show it and WorkSafe can't satisfy itself that you've done those things, then you've only got half the answer right essentially, and you're still going to be in a bit of strife. So just on to the next slide. What this one is going to portray for you is, managing psychosocial hazards. It's not just about one thing like policies, training, or wellbeing initiatives. It's a system. So there's a number of different levers that all interact to shape how you approach health and safety in a workplace and what, psychosocial health in a workplace looks like. And so starting at the top, something I'll talk about a little later on as well, it's the workplace culture. So it's the day-to-day behaviors of the organizations. And so how leaders treat people, whether the workloads are realistic, whether people feel safe raising concerns, and whether well-being is genuinely supported rather than just being talked about. So the next is data management. Businesses need to be tracking what's actually happening. So that's a little bit to the point I raised in the last slide, is that, they need to be including things like incident reports, absenteeism trends, complaints, exit feedback, etc. So without that information on hand, it's very hard to identify psychosocial risks or understand where the pressure points are in the business. It's also very difficult to evidence to WorkSafe that you've got a system in place. Then there's sort of physical conditions as well. Obviously, psychosocial hazards are often thought of as purely psychological things, but the physical environment still matters. Fatigue, long hours, unsafe workplaces, or high pressure environments, they all contribute to stress and psychological harm, or can contribute to that. So that's very important. You've obviously got legal enforcement, so regulators, as I mentioned, across Australia are increasingly focusing on psychosocial hazards under work health safety laws because of the positive duty that you have as a business to identify and manage those risks in the same way you would any other safety hazard. And so, that means policies, processes, documentation around your risk management protocols. And then there's the compliance aspect around it as well. So you'll see things like codes of practice and various other government guidances that come into play. They really set the expectations around how you do the things that the government and the regulators are requiring that you do. Very much encourage everyone to consider the code of practice around psychosocial hazards in your relevant state or territory. A lot of the services that we provide at Citation Group are really designed to align with those code of practices, but make them far more digestible and practical in practice. And so a code of practice from the regulator is essentially their Bible or their kind of gold star of how you're supposed to do, how you're supposed to operate a work health safety system that's compliant. They're also very, very detailed and can be very, very overwhelming, in my opinion, for business owners who are time poor and have very difficult a range of different difficult things to manage on a day-to-day basis. You really need to be able to condense all that rich information and have practical insights. And so absolutely encourage everyone to read it, but also at the same token, it's what a service like ours is there to do, which is to digest all that information and make it more practical for small businesses. On to the next slide. Naturally, in the business that we're in at Citation, we understand that business owners face really complicated. Well, I think Australia's workplace health and safety and workplace laws, generally speaking, are pretty much the most onerous anywhere in the world. And so, with the regulatory landscape that comes with those laws, we understand that the business owners are juggling a lot. It's really difficult to run a business in our country, and you're responsible for compliance, but you've also there to run a business. And so psychosocial hazards can feel like another complex layer on top of everything else that you need to do. And so it's absolutely there. It's not going anywhere. You need to find the most practical solutions within the context and the time constraints that you're all operating under. And so this slide kind of highlights where a lot of businesses tend to get stuck, in my opinion, when it comes to managing psychosocial hazards. That iceberg visual is kind of intentional. What sits above the surface is often only a small portion of the issue, and the real risk kind of sits underneath the surface and it bubbles up, at the least opportune times. And so starting at the top, I think a common misconception is the idea that having an EAP is enough. Whilst it's absolutely something that I think is fundamental to a safe workplaces, I think many businesses believe that if employees have access to counselling and support, then the psychosocial risk is being managed. But EAP is really a response mechanism, and it helps when someone's already struggling. But the legislation and codes of practice we've talked about a focus on preventing the hazards from manifesting in the first place. So, excessive workloads, poor job design, workplace conflict. And so psychosocial risk can feel intangible, I think, for a lot of businesses, especially given, how busy everyone is. And, unlike physical hazards, you can't always see them. So they show up in patterns over time. And so there's also something, you'd probably call managerial blindness sometimes, or out of sight, out of mind. So managers are often, very focused on operational performance. You may not recognize the early warning signs of psychosocial risk. And so, things like changes in behavior, increased tension, or consistent workplace pressure can be indicators, but they're easy to miss if leaders aren't trained on how they spot them and what the protocols that the business is trying to implement to fix them. And so another one is just lack of expertise. And so it's kind of one of the reasons that we're doing this webinar and why an organization like ours exists. But many organizations just don't have the internal capability when it comes to identifying and assessing psychosocial hazards. It's a relatively new area, and with a lot of focus from the regulators, and so businesses are often unsure about where to start or what good actually looks like, because they know about the issue because they've had a horror story, they've had something affect their business, but they don't actually understand or haven't seen best practice in this space, and therefore how you could have prevented those issues from happening in the first place, or have prevented any interrogation or scrutiny around how you managed it by way of the controls that you had in place. And so I think the main takeaway for me is that psychosocial risks, they're really less visible, more complex than traditional safety hazards. So you need more structure in how you approach identifying them and treating them, and rely on that structure because it's something that you can evidence when you're called upon to do that. And so on to the next slide. I think what regulators often find when they investigate psychosocial hazards in the workplace is what you're seeing there. On the left side is what we typically see in businesses that have run into trouble. There's no formal psychosocial risk assessment. Hazards haven't been properly identified. There's no documented control measures in place. We'll see commonly little or no worker consultation, managers who haven't been trained to recognize psychosocial risks, over reliance on EAP, as we talked about. And on the right side is what a compliant business tends to look like. They've formally identified psychosocial hazards, documented risk assessments, implemented higher order controls rather than relying on support only. They've also consulted workers. And so what we try to do in our operations within Citation HR for a business is undertake that psychosocial risk assessment for you, work with your business to identify where are those hazards against best practice and the code of practice, and how do they manifest or not manifest in your business, and what are our recommendations about how you go and address those things in an evidenceable way so that you're protecting yourself from risk. It's really trying to give you the tools and the support to be able to carry out these things that you need to do in order to comply. And on to the next slide. I think workplace culture, it's almost ubiquitous, and it can be overused, I think, in our sphere, in workplace compliance, or really any HR or workplace sphere. But when it comes to managing your health and safety duties, it's absolutely fundamental to create a positive safety culture, and that culture needs to overarch everything you do and your workplace health and safety system. So if you create a proactive system that's preventative rather than simply responding to issues and chasing your tail, you tend to be in a good stead. And so as an employer, it's your responsibility to set the behaviour standards that provide a safe workplace for all workers. And so your culture sets the standard of how you prioritise well-being of workers, and and how you will respond to issues and keep your employees safe and healthy. Your cultures and standards of behaviour, they need to be lived by management and really demonstrable, I think, to employees, because it needs to be seen and evidenced. And so if your workers see that management and leadership is putting a focus on health and safety, and they can really feel that it's a priority in the business. And these are small things, but raising health and safety issues and or always putting a focus on it in team meetings and huddles and whatnot, the employees start to feel that that becomes it's a priority for them. It doesn't need to be forced or disingenuous, but it just starts to slowly seep into the culture of the business that people's health and safety, particularly their psychosocial health and safety, is something that matters to the employer, and that's culture setting. And what that does is start to embed itself across all your systems and how people go about your work day to day. And over time, that becomes your culture. And I think that's so important, and there's lots and lots of different ways, obviously, that you influence that, and it happens slowly over time. But really comes top down leadership values that, at the end of the day, values really define behaviors and behaviors define your culture. And so if your values, your health and safety values are embedded in leadership structures, they really believe in it, that's going to define how people behave at work. That's going to shape your culture. And so building on that onto the next slide, I think we can shift in from the risks to what actually works in practice. And, building psychological safety really starts with leadership. It starts with their capability and everyday conversations. And so the first step, I think, is to train managers. Managers are usually the first people to notice when something isn't quite right in the team. That might be workload pressure, conflict, or someone starting to disengage. But many managers have never even been trained on how they recognize psychosocial hazards to respond appropriately. So you've got to give them the skills and the confidence to identify those issues. And then the second step is, I think, normalising the conversation around psychosocial safety. In many workplaces, people only kind of talk about mental health when something's already gone wrong. Instead, the goal is to bring those conversations into normal team discussions, leadership meetings, safety processes. That's what I mentioned before around, leadership driving these things and how that builds cultural change. And so I think when managers are trained and the topic becomes part of everyday workplace dialogue, organisations are much better positioned not only to identify those risks early, address them before they escalate, but also demonstrate to people whenever there's an inquiry for whatever reason that might be, to say that that's the culture of the business and look at how we document it, look at the priority we place on it. Once you've started doing that, everything else becomes a lot easier to implement. And so just to wrap up, I think there are a few key takeaways that I think everyone needs to focus on. I think the first is that there's psychosocial hazards are, unequivocally a work health safety obligation. They're not just a HR initiative or part of a wellbeing program. Regulators treat these risks the exact same way they treat other safety hazards, and all of the regulators now have a mandate from government to really crack down on this area. And you're starting to see workplace investigations and site visits specifically focused on psychosocial hazards. In the past, very much they were focused on, blue collar type industries and keeping people safe. Now you're seeing, random inspections on white collar businesses and businesses of all shapes, sizes, and profiles, based on how they're managing psychosocial hazards. So it's just something everyone needs to grapple with. And so the second takeaway, I think, is that businesses just absolutely need to have a risk assessment process in place in its business. How do you identify, assess, and control your risk proactively? Looking at the design of work, workload pressures, leadership practice, all of the things that are in the code of practice about that are key psychosocial hazards. How do your business approach them? And the audit, the psychosocial audit that is available through our services, looks at all those things in the business and helps you identify them and helps you put in place controls to the extent that that's an issue in your business. The third is, EAPs, they're absolutely fundamental. I think every business needs to have one, but their EAP programs and policies are not enough. Regulators are increasingly expecting what we call kind of higher order controls, addressing the underlying causes of psychosocial risk, workload management, job design, team dynamics. What are you doing as a business to address those things? And we can provide recommendations about simple tips about how you can do that and how you can evidence it, which is just as important. The other point, every jurisdiction in Australia has clear expectations around psychosocial hazards. And I mentioned before, enforcement activity is increasing. Each state and territory needs to understand how its regulator is, well, every business in each state and territory needs to understand how its regulator is moving and behaving in relation to its enforcement activity. And you should be looking out for the key things that you need to do as a business to comply. And then the other major factor in any organization that I'd like everyone to really think about in their own business is your manager capability. So your manager's your front line when it comes to identifying early warning signs, supporting employees, addressing issues within teams. But in many businesses, this is also the biggest capability gap in my experience. And another key point, documentation. We talked about the mass problem analogy. If your risk assessments, consultation, and controls haven't been documented, becomes very difficult to demonstrate you've met your obligations. Again, we provide a comprehensive report and action plan around our psychosocial program of work that we can provide you. And finally, you don't have to do it alone. Psychosocial risk management, it's complex. Legal principles are complex. Health and safety is complex in our country, and I think with the right tools and support, it becomes much more manageable. And so ultimately, I also think the goal shouldn't be about compliance. This is a really serious area. People's health and safety should have absolute primacy in your business. And as a business owner or as a senior leader in any business, I think your worst fear can be any person being hurt at work on your watch. Something that everyone should treat really seriously, and businesses that manage those things well, I think, see stronger engagement, healthier teams, and more sustainable performance in the long term. And so it's also just something that makes so much business sense in context, I think. So that's all from me, Mark. Obviously, address any questions that have come through in the chat, and yeah.
Yeah, for sure. Thanks, Adrian. That was really good, and I'm sure everybody's learned quite a bit today. Before we do dive into the questions, though, Adrian, I just wanted to look at that poll that we had at the beginning of the session, and then I'll have a look at some of the questions that have come through, and we'll fire them away at you. So from the poll results today, thank you for everyone as well who has answered. Many of you mentioned, so we had about 1 in 3 people that responded mentioned that they're not confident that their business currently meets its work health safety obligations for managing psychosocial hazards. Only about 11% of respondents had a formal process or assessment capabilities in place when it comes to identifying psychosocial risks. And only about 5% of respondents are very confident that their managers know how to recognise and respond to psychosocial risks in their teams. So yeah, quite significant results there as well. And look, it's clear from what I see, and I'm sure you'll agree with this, Adrian. It's clear that many businesses obviously are still working through what psychosocial compliance actually looks like in practice. And look, I mean, based on the results that we've seen, I guess everybody seems to be in the same boat with that. So yeah, just trying to obviously get on top of all managing the compliance side of that piece. If today's session has raised any questions about your current approach, and whether it would stand up to scrutiny or whether gaps might exist, we're currently actually running a limited time psychosocial services offer to help businesses take the next step with their confidence as well. So it's up until March 31st, 2026. You can actually receive 50% off psychosocial services when you engage either Citation, HR, or safety. You can also receive free psychosocial services. This is valued up to $8,000 when you engage both our HR and safety combined services as well. So some of these services that you can receive within the psychosocial space is a structured psychosocial risk assessment, a review of your policies, procedures, and control measures, practical implementation support, leadership or management training as well, and as well as an ongoing advisory guidance to help meet your work health safety obligations as well. So yeah, quite a robust service there that we have to offer. To access this, please speak to myself, one of the team. You can scan the QR code on your screen as well. If you're joining on your mobile, we'll have a link in the chat. And I might just pause briefly just to allow anybody that needs to complete the form, and we can jump into some questions for you, Adrian. There's been actually quite a few come through, so I'll have a quick look whilst we're waiting at some of these questions. Let's have a look. Adrian, so one of the questions we had, and I guess this is a bit of a two-part question. The question is, if we already have an EAP and a general wellbeing policy in place, what else would regulators expect to see? And the only other thing I'll ask is, another person asked, can you expand on the acronym EAP, what it actually means? So I'll leave that one to you.
Yeah, an EAP is an employee assistance program. So it is essentially, can take various different forms, but it's a counselling service that an employer makes available to its employees to private, confidential, independent, for employees to be able to discuss anything that's going on in their lives that's affecting their work. So yeah, it's become quite commonplace and something that's very prudent for all businesses to have. Citation has an EAP service available. Certainly something that if you haven't looked at before, I'd encourage you to get in touch with us about. And yeah, look, beyond an EAP and a general counselling, approach, you need to be able to demonstrate to WorkSafe how are you managing psychosocial hazards. So typically, our approach is to first to provide do a psychosocial risk assessment that's quite broad and sweeping and covers everything, and put in place an action plan for any actions that drop out of that, but then have a suite of psychosocial focused policies, procedures that the business can evidence as to say, here's how we approach psychosocial hazards in the workplace and our policies and procedures that everyone is trained on. That's very important. We have a very tailored specialist suite of documentation in that respect, but you need to then also have those documents and be able to show that you went and not enforced them, but implemented them in practice. To people, follow them, to managers, check in and follow the policies and procedures that the business has got in place. So, yeah, I wouldn't say it is enough actually to have more of a generic counselling policy and procedure. EAP and how employees access it is part of a more sweeping work health safety system that you should have in place.
Awesome. Thanks for that, Adrian. Another one we had here is, we actually had two with asking this question. So what does a compliant psychosocial risk assessment actually look like in practice? And one of them had there is a staff survey enough as well at the end?
No, unfortunately, it's not. So a staff survey is not a risk assessment. It's an information and fact finding tool that is informative about the types of things that employees are feeling. But really, where that falls into is what I mentioned earlier: there is a standardized best practice way or matrix that a risk assessment follows. It is the same for physical hazards as it is for psychosocial hazards. You need to identify the hazards. So a great way to do that is through a survey. Hey, employees, what are the things that are affecting you and your opinion about what are the hazards in the workplace? That's a way that you get their information about hazards. Then you need to assess the risks. What are these things? Are there any risk arising from them? Is it unreasonable risk? And then you need to control them. What are the things you put in place to minimize, mitigate that risk, and then you need to be constantly reviewing them and consulting with your workers. It's kind of that four-part matrix: identify, assess, control, and review.
Yeah. Excellent. And so another question here, Adrian, it doesn't really specify psychosocial specifically, but obviously working from home being so common these days, and being the norm, so the question asks, what is the extent of the obligations of the PCBU? And I suppose from a psychosocial standpoint to working from home, isolation and whatnot as well might pose a bit of a risk too. So yeah, what are those obligations of the PCBU for anyone working from home?
Yeah, so I think the starting point is it's the same obligation, the obligation around the duty of care, which flows into the obligation to identify, assess, control, and review. And so you need to be able, when you've got workers working from home, you need to be able to demonstrate first and foremost, have you identified what risks exist when someone works from home from a psychosocial perspective? Have they got appropriate access to people, to a social environment? Are they too isolated? What are the things that the business is be able to show that it did to identify those hazards? And then you need to show, are there things in place that you do as a business to prevent those hazards manifesting into an injury? And so if you can do that, the mere fact that someone develops, a stress condition or another type of injury stemming from what they believe is the work environment, if you can demonstrate that at a certain point in time you identified those hazards and then you put things in place to try and control them, that's enough, as long as that is reasonably practicable. If you did enough to be able to say, we know these people are working from home, we know the situation with this employee, this is part of what we do as part of our broader work health safety system. You're not asked to make sure it's not your obligation to make sure no injuries occur in the workplace. Your obligation is to, so far as reasonably practicable, mitigate the risk in proportion. So it's really just about making sure, can you show that you identified those hazards? Can you show that you put in place reasonable controls in relation to them?
Excellent. Thank you for that. And look, we'll probably have time for one more. Just so you guys know as well, if we don't answer your questions today, we will be more than happy to talk to you offline, and we'll be in touch after the webinar. But just the last question here, Adrian. How exposed are directors or senior leaders personally if the business hasn't formally assessed or addressed psychosocial risks?
How exposed? Well, they are directly exposed under the legislation. Officers of a business, for whom directors are, have what's called due diligence obligations, and those due diligence obligations, in essence, require the officers of the business to stand in the shoes of the business and make sure that that business carries out its obligations. So obviously a PCBU is not a living, breathing organism. And for that reason, the legislation requires that someone be responsible for making sure that business carries out its obligations. That's what due diligence is. It's the same type of obligations that a director has under the Corporations Act. So to make sure the business is solvent and operates as a going concern, the same obligations of a director. So your job is not, as a director, is not to go and do all the things that the business does operationally on the ground. It's to make sure there are things in place for people to do it so far as reasonably practicable. And yes, the net result of failing to do that can result in personal liability under the health and safety legislation, in the same way that personal liability arises out of corporate governance legislation and fiduciary duties that directors have under Australian law.
Lovely. Awesome. Well, thanks, Adrian. Really appreciate you answering those questions. And look, sorry we couldn't get to them all. But yeah, this is all we have time for today, guys. I'd like to thank everybody for joining us today on this presentation. And I'd like to once again thank you, Adrian, for sharing your expertise with us today. As I mentioned at the start as well, we'll be sending a follow-up email later on today, which will include a link for that. So please keep a lookout for that as well. And as always, if you do have any questions, guys, or would like to schedule a chat with us to discuss any of today's topics, please feel free to get in touch. Our contact information, is on the side here, and we will look forward to hearing from everybody soon. So thanks again, everybody, and enjoy the rest of your day.
Thanks very much, everyone.
Cheers.